Microbubbles, tiny gas-filled spheres just a few micrometers in diameter, are revolutionizing the field of drug delivery and medical imaging. One of the most exciting applications is ultrasound mediated drug delivery, where these bubbles act as precise drug carriers that release their therapeutic payload only at the desired site inside the body. But how are these microbubbles made, and why is this method so important? The answer lies in microfluidic fabrication, a cutting-edge technology that allows researchers to create highly uniform, stable, and functional microbubbles for controlled drug release. Imagine a scenario where a patient with a brain tumor needs chemotherapy. Traditional methods flood the bloodstream with toxic drugs, affecting both healthy and cancerous cells and causing severe side effects. Now, picture a new approach. Instead of injecting free drugs, a doctor administers drug-loaded microbubbles into the bloodstream. These microbubbles remain inactive and harmless until the doctor applies an ultrasound beam at the tumor site. The ultrasound waves make the bubbles vibrate, expand, and eventually burst, releasing the drug precisely where it is needed. This localized drug release minimizes side effects and improves treatment efficiency, a game changer for cancer therapy, stroke treatment, and even gene therapy. But how are these microbubbles produced? Traditional methods like shaking or gas dispersion create bubbles of varying sizes and stability, which makes it difficult to control drug delivery. Microfluidic fabrication, on the other hand, provides a highly controlled environment where microbubbles are formed one at a time in tiny fluid channels. By precisely controlling parameters like flow rates, gas composition, and surfactant concentration, researchers can produce microbubbles that are consistent in size, stable for long periods, and designed for specific medical applications. Why is this size control important? The size of the microbubble determines how it moves through the body. Smaller bubbles can pass through tiny blood vessels, making them ideal for reaching the brain or deep tissues, while larger bubbles provide stronger acoustic responses for enhanced ultrasound imaging. For instance, contrast-enhanced ultrasound scans use microbubbles to highlight blood vessels and detect tumors, improving diagnostics for cardiovascular diseases and cancer. A real-world example of this technology in action is in the treatment of blood clots, thrombosis. Instead of using aggressive clot-busting drugs, which carry a risk of bleeding complications, microbubbles, loaded with clot-dissolving agents, can be directed to the blocked artery. Ultrasound is then used to disrupt the clot and release the drug, reducing treatment risks and speeding up recovery. Beyond drug delivery, researchers are exploring gene therapy applications where microbubbles transport DNA or RNA directly into cells, a potential breakthrough for genetic disorders like cystic fibrosis and muscular dystrophy. As microfluidic fabrication techniques advance, we can expect even more sophisticated therapeutic microbubbles, possibly with targeting ligands that allow them to seek out specific diseased cells. The combination of ultrasound technology and microfluidics is opening new doors for personalized, non-invasive, and highly efficient medical treatments. Could this be the future of precision medicine? Microbubbles are microscopic gas-filled spheres stabilized by lipid, polymer, or protein shells. These structures enhance ultrasound imaging and act as carriers for site-specific drug delivery. Their small size, typically 1-10.1, allows them to travel through blood vessels, while their shell material determines stability, biocompatibility, and drug-licking efficiency. The gas core, often composed of perfluorocarbons or nitrogen, enhances ultrasound reflectivity and ensures controlled cavitation, making microbubbles a versatile tool in diagnostics and therapy. Lipid-based microbubbles improve contrast in ultrasound imaging and serve as drug carriers, whereas polymer-stabilized bubbles provide longer circulation times for sustained therapeutic effects. Microbubbles function like helium balloons coated with a protective layer, light enough to float, travel through blood vessels, but durable enough to carry essential cargo. drugs, or imaging agents. Microfluidic platforms offer precise control over microbubble size, stability, and composition by regulating gas to liquid flow ratios. Traditional methods, such as sonication, generate polydispersed bubbles with inconsistent properties, whereas droplet-based microfluidic systems using flow focusing or TJ junction designs create uniform microbubbles with tunable characteristics. These devices allow real-time control over gas-liquid interactions, resulting in monodispersed microbubbles, ideal for biomedical applications. Microfluidic devices can produce microbubbles with an exact diameter of 5, ensuring uniform acoustic response and predictable drug release kinetics in therapeutic applications. This process is like a precision coffee machine, ensuring uniformity and quality in every batch. Ultrasound waves interact with microbubbles via cavitation, inducing controlled expansion and contraction. These oscillations increase the permeability of blood vessel walls, facilitating drug transport across biological barriers. Depending on the intensity, cavitation can be stable, low-energy oscillations that enhance permeability, or inertial, higher-energy collapse that promotes drug penetration into target cells. This mechanism allows for localized, non-invasive drug release while minimizing systemic side effects. In cancer therapy, ultrasound-stimulated microbubbles help chemotherapy drugs penetrate solid tumors by temporarily opening tight endothelial junctions. Microbubbles act like tiny battering rams that vibrate against cell barriers when triggered by ultrasound, creating momentary openings for drugs to pass through. Drugs can be incorporated within microbubbles in different ways, embedded in the shell, dissolved in the gas core, or adsorbed onto the surface. Hydrophilic drugs integrate within the shell matrix, while hydrophobic drugs bind to the exterior, allowing for efficient, controlled release. By functionalizing microbubble surfaces with targeting ligands, researchers can enhance specificity, ensuring that drugs reach the intended site without premature clearance. Doxorubicin-loaded lipid microbubbles improve localized chemotherapy delivery to tumors while reducing toxicity in healthy tissues. These microbubbles function like time gleamer capsules, delivering medication precisely when and where it's needed. Combining microbubbles with magnetic nanoparticles enables guided navigation through the body using external magnetic fields. This approach improves targeted delivery by directing microbubbles to specific tissues, reducing off-target effects. Once accumulated at the desired location, drugs are released via ultrasound cavitation, maximizing therapeutic efficiency. Magnetically functionalized microbubbles are being explored for targeted gene therapy, where ultrasound activation ensures localized genetic material delivery to disease cells. These microbubbles act like GPS-guided drones, traveling through the bloodstream to reach their designated site before unloading their therapeutic cargo. Microbubble-based ultrasound therapy has broad clinical applications, particularly in oncology, neurology, and cardiovascular medicine. In cancer treatment, microbubbles enhance chemotherapy efficacy by improving tumor penetration. In neurology, they facilitate drug transport across the blood-brain barrier, BBB, for treating conditions like Alzheimer's and Parkinson's. In cardiology, microbubbles deliver clot-dissolving drugs, reducing stroke risk. Microbubbles combined with ultrasound help transport therapeutic agents across the BBB, enabling non-invasive treatment of brain tumors. Microbubbles function like small ferry boats, crossing biological barriers that drugs alone cannot easily navigate. Microbubble longevity in circulation depends on shell composition, gas solubility, and surface modifications. Lipid-based microbubbles degrade rapidly but provide superior biocompatibility, whereas polymer-stabilized microbubbles ensure extended circulation. Incorporating perfluorocarbon gases increases stability due to their low solubility, preventing premature dissolution. These factors collectively optimize microbubble-based drug delivery efficiency. Perfluorobutane gas microbubbles exhibit prolonged stability compared to air-filled counterparts, enabling extended imaging and therapeutic applications. Microbubbles are like soap bubbles in water, Some pop quickly, while others, with protective coatings, last longer for effective delivery. While generally safe, microbubble therapy carries risks, including endothelial damage, immune responses, and unintended tissue interactions. Excessive ultrasound intensity can cause uncontrolled cavitation, leading to microvascular injury. Careful optimization of ultrasound parameters ensures a balance between therapeutic efficiency and patient safety, minimizing adverse effects. Adjusting ultrasound frequency and intensity reduces the risk of cavitation, induced tissue damage in delicate organs like the brain. The process is akin to fine-tuning a speaker volume. Too low, and the effect is insufficient. Too high, and it can cause damage. Ongoing research explores hybrid microbubbles incorporating nanoparticles, smart materials, and AI-driven ultrasound guidance for enhanced precision medicine. Advanced gene editing techniques, such as CRISPR-loaded microbubbles, open new possibilities for treating genetic disorders. Personalized medicine approaches aim to tailor microbubble compositions to individual patients, optimizing therapeutic outcomes. Nanoparticle-loaded microbubbles, combined with ultrasound, are being tested for non-invasive gene delivery to correct genetic mutations in inherited diseases. These innovations function like next-generation smart pills, adapting their behavior to maximize therapeutic impact while minimizing side effects.